I had 2 near-death experiences. The only reason I'm alive is a helmet and an amazing hospital. And coming out of that, I was like, oh my God, I got a second chance at life. I'm not going to risk this second chance. I'm not going to blow it. And so I started trying to navigate the primary care and preventive healthcare system instead of the reactive sick care hospital system for the first time in my life. And as amazed as I was by how incredible the healthcare system is at saving lives, I was equally as mystified at how terrible it is at preventing disease and working with otherwise healthy patients to prolong healthy life.
Welcome to Inspired. I'm Alexa Von Tobel. It is no surprise that the American healthcare system is broken. We wait until something goes terribly wrong to see a doctor. In fact, 80% of strokes are preventable, yet our entire system waits for that stroke to happen before we take action. The healthcare system is built around that moment of crisis, not the 20 years leading up to it. Today, I'm joined by Alan Tisch, a repeat entrepreneur who co-founded Spring, a commerce platform. After selling that company and then surviving 2 near-death experiences, he decided to take on the most ambitious feat of them all, rewiring the entire American healthcare system. He built Atria, which brings together 15 medical specialties, cutting-edge imaging technology, and a research institute with over 100 academic fellows from all around the world. Today, they're using every tool we have to actually prevent disease and to help people live not just longer, but better.
If you're running a startup, we know things like managing equity and communicating with investors are always top of mind. Carta has built a connected suite of tools that over 40,000 companies use to do just that. Their platform of software and services helps you lay the groundwork so you can focus on building. To learn more or get started, visit carta.com.
And with that, let's welcome Alan. Alan, first of all, I'm so excited to have you on today. And you've just done so many things in your short life already. And I want to quickly start by saying just first, thank you for helping shape the future of healthcare and health. As I was prepping for this, I'm really excited about the content we're going to cover. I want to rewind and start from the beginning. Let's talk about your childhood. You grew up in a really prominent family. You clearly are very entrepreneurial. If you go back to your childhood, what stands out that helped you become the entrepreneur you are today?
Well, first and foremost, I just want to say thank you, Alexa. I have been a big listener of Inspired over time, and it's an honor to be here with you, and I really appreciate you and the team taking some time. If I think back in preparation for today, I was spending time thinking about what influenced me. How did I end up here and why? And I think the reality is that we're all so influenced by our surroundings when we grow up, right? And for me, I think there were a couple of things that were true. I was a late 80s baby. I'm a millennial by definition. And what that meant is growing up in my childhood, I was exposed to the internet coming about for the first time. Online chat rooms, AOL, dial-up internet, and then saw some of today's generational companies in their earliest days, right? When I first started using the internet, it was Alta Vista that I was going to, not Google, right? And was using GeoCities and Yahoo. And then you saw Google and Facebook at the time. You were required to have a college email address to join. So when I got into college and got a college email address, I was so excited. So I think that kind of sets the background of like growing up at a time when new businesses were being created overnight. I'm 12 years old. You see the dot-com bubble and you hear about those things and see your parents stressed out about the financial implications of the crash of a stock market. Yet at the same time, in the years after, in my adolescent years, every day new businesses were being created. I was adopting new technologies, new platforms. And then on the flip side of it, I grew up, as you mentioned, in a large, prominent New York family. And I was fortunate enough to be able to get to know my grandfather for the first 10 or 11 years of my life, who throughout his life really built an incredible company from absolutely nothing. It had a profound impact on New York and the world. And I think for me, I grew up and saw that, and that was kind of the only option, right? I was like, I don't want a job. I want to make a really big impact. I want to build something. So when you kind of, grow up in a prominent family, for me, it meant raising the expectations of what I expected of myself from a very young age. And then you also see every single day new companies, new products, new services being created, growing, IPOing, being successful. And I think that backdrop for me, I only get one life, but like it was a dream idea to grow up in the time when the internet was being formed and new businesses were being built and industries that have existed for 50, 60, or 100 years were changing overnight. And I think it gave me an optimism that anyone can start a business and anyone can change anything, no matter how hard it might seem at first.
Alan, I do want to take a minute and ask, obviously your grandfather was an incredibly successful businessman. What did you learn from him? What did you observe? What were sort of the takeaways that you can pay it forward to all of us?
Yeah, it's funny. I was fortunate enough to spend time with my grandfather while I was growing up and young, and I think one of the biggest takeaways was how important family is. There were really only two things in life that my grandfather loved from the time I was able to spend with him. One of them was being able to build businesses that had a positive impact in this world, and the other was spending time with family. And I think that prioritization of prioritizing work above fun and above travel and above so much is really important, but nothing comes above family, right? And I think that for me, I'm at a time in my life right now where I'm fortunate enough to be able to work 100 hours a week and build something with an incredible team. And it has to be harmonious with what other priorities are. And for me, that's family and things like that. And I think the realization that, it's okay to work hard and not everything has to be in balance all the time was one of my biggest takeaways.
I love that. By the way, what a good value system for you to get to see firsthand. That's wonderful.
Yeah.
Okay, so fast forward. You grew up in New York.
Yes.
You went to school in Michigan, and then you came back to New York City to NYU for your MBA. You were a sneakerhead at age 13, which I love. And clearly you had an entrepreneurial streak. And then you and your brother David started a company together. You co-founded Spring. Now that you are a true repeat entrepreneur, tell us, what did you feel like you learned from Spring that you're taking with you into today?
So much. I think first is building anything. Once you realize that those unknowns are solvable and you can figure anything out, I think that just gives you the confidence to kind of work on harder problems, right? I started selling sneakers on eBay when I was 12 years old and PayPal didn't deliver. It was cash on delivery, and taught myself basic front-end web development on GeoCities at the time. And fast forward about 12 years, I'm then running a business, multi-brand marketplace, Spring that you mentioned. And any problem that we saw, we didn't have an expertise. We were young. The average age of our team at that time was probably 25, 26 years old. A lot of us just straight out of college. And I think when you build something the first time, whether or not it's successful, you ultimately gain confidence in being able to figure out any problem, right? And I think that was a very big learning. I think the biggest learning for me, though, was, we were fortunate where the company launched. We had an incredible launch, a lot of consumer interest. It was a very trendy moment in commerce and mobile commerce and app-based commerce. And we kind of had this moment about 2.5 years in where we had our best day as a company. We, for the first time ever, had done over $1 million in GMV that day. Whole team, there was about 150 of us at the time. And we went to like Dos Caminos on Park Avenue South, had a happy hour after. And I remember everyone that day was sitting there being like, oh my God, we're gonna build the next Amazon, best day ever. And it was funny because I went to bed that night and I was like, I don't care. And it's kind of odd, when everyone else was in such a celebratory mood, I was a little bit down. And I just was like, I don't think this is what I want to spend my life doing. If I'm going to go through this entrepreneur roller coaster and dedicate the time and the effort, like, my legacy is not going to be that I figured out how to sell Michael Kors handbags to someone in Southeast Asia for 27% off. But I was loving the idea of building with a team, waking up every day with enthusiasm and optimism, but I was like, I think my attention is focused in the wrong area. So it was in that moment, which was about 4 years before we sold the company, that I realized whatever I did next, and I was definitely going to do something next, it had to be something that I was personally passionate about. Because if you're gonna push yourself this hard, like, only people that wake up and go to bed and shower and dream and think about these things are going to be successful. Otherwise, someone else is going to outwork you, right? And they're going to win because it's natural. And so I think for me, I was very purposeful the second time around what I wanted to build and making sure that it was aligned with what I care about, my passions and my values. which I think is not surprising, right? Oftentimes you see second time and third time and repeat founders go into industries that are much harder, much larger, and oftentimes personally relevant, which is why I think, if you look, there's a lot of second-time founders that end up in healthcare and wellness because they're like, hey, if I'm going to do this, it's got to be something I care about and want for myself or my family.
That's really well said. And actually, what a great moment. Basically, on one of the more successful days of the company, you went home and kind of realized, I actually had a similar feeling once when I was working at a big financial institution, and I was like, I'm literally just moving piles of money around and doing nothing productive for the world. And so I very much understand that. Okay, let's fast forward to Atria. I was fortunate to get to chat with you years ago as you were thinking about standing up the business. What was the aha moment? And then tell everybody exactly what you're building and what it looks like.
I think for me, and I'm stepping back on a personal level, so here I am in my mid-20s. I decided that I didn't want to be running an e-commerce business for the rest of my life, had a commitment to our team, and we were fortunate enough to have a really good and productive exit. And then here I am, and I was like, wait, I'm free. What shall I do with my life? And in a 6-month time span in my mid-20s, I had 2 near-death experiences. The only reason I'm alive is a helmet and an amazing hospital or 2 and some surgeons. And coming out of that, I was like, oh my God, healthcare is amazing. Like, the healthcare system just saved my life. The human body's amazing. Anything is possible. So here I am, and I'm like, I got a second chance at life. I'm not going to risk this second chance. I'm not going to blow it. I was like, so once after about 6 or 7, 8 months, multiple surgeries, lots of physical therapy, lots of pain, I come out of it and I was like, I'm never going to feel that way ever again in my life. I'm going to take a proactive approach. I'm not going to leave things to chance. I'm going to know where I stand, and I want to live in a modern world where I do everything in my power to prevent ever feeling like that again. And didn't seem like a crazy request. I'm like, a lot of people would want that. And so I started trying to navigate the primary care and preventive healthcare system instead of the reactive sick care hospital system for the first time in my life. And as amazed as I was by how incredible the healthcare system is at saving lives, I was equally as mystified at how terrible it is at preventing disease and working with otherwise healthy patients to prolong healthy life. So I had looked around a bunch. I went to a bunch of these executive healthcare clinics. They do a bunch of scans, do a bunch of tests, give you 70 pages in a PDF at the end and say, come back in a year or 2. And I was like, wait a second. Good to know that I don't have cancer growing inside of me right now, but like, that's not going to change outcomes. That's not going to make me feel better, not make me live a healthier, longer, happier life. So I signed up for a concierge doctor in New York City because that seems like the only people that will spend more than 12 minutes with you in our broken healthcare system today, unfortunately. And I go in and I said this to him. And he looks at me and he's like, lose 5 pounds and don't drink as much wine. I'm like, not really what I'm looking for. And I go back about a month later with a stack of papers about this big with everything from whole genome sequencing to intermittent fasting to hot and cold therapy to whole body MRI to calcium scores. And I said, I want to talk about these things and I want to talk about how I use them. And he looked me straight in the eyes and goes, you should see a psychiatrist. Nobody that is 28 years old should ever be thinking about these things. And I was like, whoa. I was like, now I'm really lost. And so I had kind of decided at this time as I was running around, I was like, there's this opportunity here because I can't find what I want for myself. And on the flip side of it, I've grown up with a mother that's had primary progressive multiple sclerosis for 40 years. And she lives in and around New York City and had great access to academic medicine physicians, yet none of them would ever talk to each other. And I remember she would oftentimes ask like, what should I eat? What exercises should I do? What supplements should I take? How about this thing that I read a headline about stem cells or hyperbaric? And the answers largely throughout my childhood that she got, and I didn't realize until later when I started building, were like, you're screwed anyways. I don't have the time. Oh, don't bother. You're screwed anyways. So here I am, and I was like, wow, healthcare system, amazing at saving lives, but really, really bad at preventing disease, really bad at service, really bad at access, really bad at quality. So I start running around and I'm talking to anyone that is a physician that'll talk to me. An ER physician, someone in residency, then they connect me with this person, that person, someone in private practice. And I always ask the same question. If we were to start a new healthcare system from the ground up, solely optimizing for the prevention of disease and prolonging of healthy life, using every tool and technology, as well as piece of scientific and medical information available to us, what would that look like? And as an outsider, I was like, oh, that's the most basic question. I assume that everybody at these Ivy League academic institutions asks this every day. And universally, I got the same answer. I had a dozen doctors look at me and laugh in my face. And they were like, child, please, you do not understand healthcare. We talk in RVUs and downstream revenue and an 8-to-1 administrator to physician ratio. Insurance companies decide what technologies, what tests we use and what things we can prescribe. Like, this is cute, but like, haha, like not possible. And I was like, wow. We've really lost the plot here, because every one of them, when they went into medical school or residency and decided to go into debt, they all wanted to help people. They all wanted to practice cutting edge medicine. They all had the best intentions. But the system over time beats them down and puts this metal ceiling on them, not even glass. It's wild. You can't even see what's above it. And then I'm like, well, why? How did we end up here? And I'm a big believer that if you want to create a behavior, you have to create an incentive for it. And ultimately, when I stepped back and looked at the incentives in the healthcare system, Medicare, Medicaid, insurance, employer-based, et cetera, all of the incentives are to treat sick people. And the sicker people are, the more money everyone in the system makes, from insurance companies to PBMs to pharmaceutical companies to hospitals. The reality is that hospitals make money on surgery and oncology and inpatient care. They lose money on primary care. They oftentimes do it only as a feeder for downstream revenues. So, I'm a big believer in capitalistic societies and principles, but one of the downsides of them is that you have these nonprofit hospitals that are nonprofits that make billions of dollars a year that are overly optimized from a profit point of view, which is understandable. That's their job, right? Otherwise, people would lose their jobs. But we've ended up in a place where healthcare has become such a large business that the healthcare that we offer today in America is reactive sick care. It's a safety blanket because the incentives are not there to prevent disease. And you might think for a moment, oh, insurance companies, they definitely would love to prevent disease. But here's the problem. The majority of Americans have their healthcare insurance provided by their employer. And the average duration of employment for a population in America is 18 months.
Wow.
So even if an employer is like, oh yeah, if we spend $150 today for a calcium score to make sure you're not gonna have a heart attack, that's gonna be better for you, better for society, better for your family, cheaper for me in the long term, higher GDP productivity, higher lifespan, higher health span. But then they're like, well, wait, you're gonna leave in 18 months. So let that be somebody else's problem. And then you have Medicare and Medicaid that kick in, so everybody just kicks the can down the road until it's the government's problem, right? There's no incentive to prevent disease, even if we all know that it's better for society, better for health span, and better for outcomes. So it's a long-winded way of saying, I think we looked and we're like, well, the entire world is barreling faster and faster into reactive sick care, which is necessary, but it's not healthcare. Yet we entered a time where you have this massive growing wave of consumer interest in preventive healthcare, wellness, longevity. Patients and people are listening to hours of podcasts a week, going deeper into basic chemistry than they ever needed to before, trying to be their own doctor. Every dinner conversation today is around peptides and cold plunges. It's no longer about what tequila do you love. Yet, the healthcare system, it was impossible to get this kind of care and to have somebody that could talk about it. And it wasn't the doctor's fault. They weren't set up for success. They didn't have the time or the incentive to do it. So for us, we're like, what would it look like if we built a new healthcare system?
So we're going to get there. We're going to get there. I wanted to say one thing that really deeply resonates with me. I grew up in a family of doctors. I think I'm the least educated person in my family by a lot, and they remind me regularly. But almost everybody in my family is either a doctor or a nurse, everywhere on every side. And I will tell you, it really is sad how much the system, everything you said is true. Doctors are beaten down by the system. And what you're talking about, I mean, in so many ways is headline news everywhere. I feel like the world has been paying so much more attention to how broken our healthcare system is. And you are taking on, I mean, what you described, from getting away from reactive sick care to getting to incredible, proactive, preventative, let's add a decade or more to each of our lifespans. Sign me up. Like, I really, we're in. But let's quickly talk a little bit of, how do you even do that? That is probably one of the most ambitious, hairiest, hardest problems, to think about rewiring our healthcare system, which, as you know, is a monster. So talk a little bit about what is Atria? Like, what is it today? Where do you want to take it? But let's just start with, what is it today to be a customer at Atria? What does it look like and feel like?
Yeah, I think for us, we stepped back and we looked at population level data and we said, what kills you or gets in the way of you living a long, healthy, happy life, right? And Peter Attia uses a similar framework called the Four Horsemen in some ways. You have cardiovascular disease, you have neurodegenerative diseases, Alzheimer's, dementia, Parkinson's, you have cancer, and then you have a fourth bucket that are metabolic and lifestyle, hypertension or high blood pressure, insulin resistance, inflammation that leads to type 2 diabetes, and that fourth category leads to a exponential increase in the incidence rate of the first three. So the first thing we did was say, what does the existing healthcare system do to screen for and prevent these diseases versus what was technologically possible today? And we realized that the gap was wide and getting wider by the day. So with Atria, there's really three core things that we do that are different than others. The first is that it's multidisciplinary, collaborative, team-based care across medicine and lifestyle. So we have 15 specialties from internal medicine, cardiology, neurology, gynecology, endocrinology, GI, pulmonology, medical dermatology, pediatrics, and emergency medicine, alongside lifestyle interventionalists in sleep, exercise physiology, physical therapy, nutrition, naturopathic, functional medicine, as well as gerotherapeutics. Today, it is too simple to just go to one person and expect they can do everything. And the problem is that our healthcare system is organized by ologies, cardiology over here, neurology over here, and they don't talk to each other. So the first thing we needed to do was realize that the human body is not organized the way that the CMS billing code is organized. But hospitals are organized the way the CMS billing code is.
It's so well said. I'm smiling because you're like, the body actually is all connected. It
is all deeply connected. What's good for the heart is good for the brain, is good for the gut, and it's all connected. Yet the healthcare system is organized in silos. So the first thing we do is we break that down and we practice team-based approach. Every one of our patients is a chief medical officer and a team of specialist physicians and lifestyle interventionists. The second thing we do is we use every piece of technology today that's available to screen for and prevent and predict disease, as well as provide objective data to help us adjust lifestyle as we go. So that's having a full imaging center, whole body MRI, coronary calcium scores, CT angiography, bone density, body composition, VO2 max, stress echocardiograms, mammography. There exists technology today to screen for these diseases. It's largely going unused because insurance companies won't pay for it, which has caused a direct-to-consumer offer this one test at a lower price than your insurance company will offer you. A huge industry of new wave of companies that have been started there, which I think is a net positive. The problem is if you don't have anyone to interpret that data and work with you, it doesn't really mean anything. And then the third aspect that I think really differentiated us was that we are not going to be a one-time visit, come here and get screened. Because how you actually change behavior or change outcomes is tens of thousands of small decisions over a longitudinal period of time with objective feedback loops. So in my mind, what Atria is able to do is to deliver a holistic approach to prevention of disease and prolonging of healthy life through 4 steps. The first, using technology to make sure that there's nothing growing inside of you today that could kill you in the near term. Whole body cancer screening, CT angiography to look inside the arteries. Nobody should ever die of a heart attack unexpectedly today. We can see them coming 20 years in advance. So step 1, make sure there's nothing that could kill you in the next 5 years using technology. Step 2, have a great, real, longitudinal, empathetic relationship with a primary care doctor and a set of necessary subspecialists to reduce risk of chronic disease, right? Inflammation, hyperlipidemia, hypertension, insulin resistance, things like that. Once we've done those 2 things and you're medically healthy, Then the third step is really to help you think about your lifestyle. What do you put in your body? What do you do with your body? How do you sleep? How do you recover? And how do you handle stress? And then once we've done all three of those things, then we can talk about gerotherapeutics or longevity, peptides, stem cells, hyperbaric, red light, all of those. The problem is that there's so much consumer interest around that fourth category. But unless you get the first three right, sitting in a bucket of ice for 6 minutes a day is not going to save you if you have a 70% blockage in one of your arteries, right? So like, we need to do the foundational building blocks first before we do anything else. And I think that's what makes Atria unique, is we're a relationship, longitudinal relationship-based service that helps people every step of the way and starts with the scary stuff, optimizes for reduction in chronic disease, helps optimize lifestyle, and then helps you make informed decisions around things that are more in the evidence-informed world and less in the evidence-based world once we have a really strong foundation.
I have so many questions I'm excited to ask you, and I'm trying to decide in what order. But one thing I'm going to dive right in on is, what's one health fad that's overhyped and underhyped, in your opinion?
I think the vegan diet, in my opinion, and I know this is going to be controversial, is overhyped. Protein intake is necessary for bone density, bone strength, muscle mass, things like that. And yes, there are ways to get it, but I think, to me, it's more whole foods, things that come from the earth or animals or if even fish and things. So I'd say the vegan diet, I think, there are ways to be very healthy without having to go vegan, I think is slightly overhyped. I think underhyped is a lot of people in the healthcare industry have created this meme and discussion that preventive imaging leads to incidental findings and isn't good for you. I think that's massively dangerous, right? Because not all imaging is the same ultimately. And if we take the example of cardiovascular health, someone can have a normal lipid profile. Their lab markers look okay, but they have a family history of cardiovascular disease, and they could be 43 years old and have a heart attack or an MI just because they had a blockage of the artery. There is a $150 out-of-pocket test that can see inside your arteries that takes less than 10 minutes. The idea that we don't do that at a population level today is baffling. Because cardiovascular disease, there's tons of things that we can do when we know that's there to prevent it from happening. We live in a time today where there's no longer a technological barrier, and the cost barrier has come down to $150 at most.
We should all be doing that test.
Nobody should ever have a heart attack unexpectedly, ever. And there's good and gooder versions of it, right? A calcium score looks inside and gives a score. A CT angiogram will actually be able to see soft plaque and calcified plaque using AI interpretation clearly in heart flow, then can tell you where it is. But no human being today, especially in America, should ever die of a heart attack randomly one day when we can see these things coming 20 years in advance. It's ridiculous.
What's the name of that test for everyone listening again?
Either a calcium score or a CT angiogram.
Okay, I'm getting one after this with you. We're going to go together.
You should. Come on in. We can do it today.
That's incredibly helpful. Okay, so first of all, so much of what you just said is so it's such sense making, which is think about the biggest things that can kill you, go proactively see them, and then once you've been able to figure all that out, then talk about specific to you what matters so that you properly manage your behavior, because as we all know, that's a huge part of this. Talk to me a little bit about how you think about the full MRI scans. How do you think about genomics? I've been fortunate to have some really good healthcare where they were able to look at my genes and come back to me and say, here's the things that you should play offense to. Here's what we don't have to worry about. How do you think about those things for the mass population?
Yeah, so they're tools, right? And tools are only effective if they're used by people that know how to use them. And one of the problems right now is there's a large gap in between tests and diagnostics that are available, and the price of them is coming down. Yet, clinicians are not yet prepared or incentivized to use them, right? So many people oftentimes will be like, oh, I went out and I got a Prenuvo scan and I got my whole genome sequenced and I did pharmacogenomics and nutrigenomics. And then I went to my primary care doctor and they weren't interested because they only had 7 minutes and asked if I was sick. So the problem is the interpretation layer, not the creation of data. So as you think about the things you mentioned, genetics over the coming decade will be a foundation of how we deliver healthcare. So right now we deliver healthcare to a population level. The future of healthcare is what we would call precision medicine or N of 1 medicine, taking your unique genome as well as your unique phenome and saying what is right for you. Because the reality is that any intervention, lifestyle, medical, or supplemental, can be right at the right time, at the right dose, for the right duration, for the right patient. But it might not be right for someone else. So for example, when I got my genetics done, I had something that about 20% of the population does, an MTHFR mutation. And I'd been taking a supplement because I was deficient in a certain vitamin for a number of years, thinking I was doing the right thing. But because of a genetic mutation, it wasn't working. I just had to order a synthetic version of it, same price, bottle looks the same. Next thing you know, 3 months later, my lab values are totally within range in a really good place. So there are today the ability to do something called pharmacogenomics, or understand what types of medicines would work or not work for you. Nutrigenomics. There's things like polygenic risk scores that will be able to say you have a higher risk of cardiovascular disease, you have a higher risk of colorectal cancer, you have a higher risk of breast cancer. We should screen you more often. So I think genetics are a foundational piece of data that will allow us in the healthcare system to personalize everything we do, from screening to medication to supplements to lifestyle advice for you. Whole body MRI, I think, there's the discussion of incidental findings, right? So yet again, I step back and I ask the question of, well, okay, why is that bad? Well, the reason that it's bad is because the majority of whole body MRIs that are being done today are being done by standalone businesses where that's their only business. You pay them for an image, they give you a report, but then when they find things, what happens? Who follows up? So I think if it's something that's being done by you and your clinician, it's a great idea, because if we break down what could be found on whole body MRI, if it's cancer, you definitely want to know. The name of the game in cancer is finding it early. So if God forbid you have cancer, you should be so happy that you did a whole body MRI and found that. If you have a brain aneurysm, similarly. What happens more often than not, though, are these things called cysts that are incidental findings. We all have abnormalities in our body. Every human body is totally unique. That's not scary. What's scary is when you go in, you pay $500 or $1,500 for an MRI, you get a PDF report that says, oh, you have a 3 mm cyst on your brain, and nobody's there to follow up with you, nobody's there to tell you what it is, and nobody's there to be like, hey, you shouldn't worry at all. 15% of the population have these. It's likely nothing. All we need to do is a repeat image in 3 months to confirm that it's been there since you were born, and then you can go into your life with the confidence and trust there's nothing growing inside of my body that I should be scared about. I think the reason that there's this discussion of the downside of incidental findings is because it's not physicians that are ordering these, and it's not your ongoing relationship that's able to help manage these and do the follow-up and follow-through. So I'm a big believer in genetics, and I'm a big believer in preventive imaging when done in this setting with your physician that can provide longitudinal care. Because so long as you have someone on that journey with you, you're going to get to a place at the end of those initial scans where you have more peace of mind and more freedom to go live your life than you ever have before. You will eliminate the fear of, ooh, could that be cancer? What's that? What if there's something growing inside of me? You have 100% certainty there's not.
And to your point, playing offense for your health is the way we should be managing it. So being able, and then to your point, also having a full body scan, you then actually have the confidence of saying, okay, I at least now know as of this date that I don't have anything horribly scary. And I actually think that's incredibly good for people to be able to have that confidence.
But like, this is a bad analogy, but I'm sitting in a room and there's a door right there. Would you rather know if there's a grenade on that other side of the door or not? Or would you rather just open the door, right? Like, I'm gonna leave if I know it's there, no problem. So like, I think for me, once you get over being scared of the unknown, you realize how powerful it is to know and to have the confidence and to not have that underlying fear and anxiety.
Exactly. I will say, having done 2 full body scans in my lifetime, it's incredibly confidence producing. I feel healthy. I feel good. I feel safe. One of the things that I really like about what you're building is you really have 2 businesses together. You have the clinical side that serves your members and has this incredible suite of, your care team. But you also have a research side that's pushing science forward. Can you talk a little bit about that research side? And you partnered with Dr. David Dodick, who spent 30 years at Mayo Clinic, which I admire. There was a big Mayo Clinic where I grew up. Who's your chief science and medical officer. Talk a little bit about the research side of your business, Alan.
Yeah, so I think what we realized is that there's actually no standard of care today for preventive medicine. The standard of care was written by insurance companies in the 1990s based upon what they wanted to reimburse. Take another example. You go to Quest, you go to LabCorp, and you get a set of labs, and they have the yellow, green, and red, in range, out of range, right? Me as an outsider, I was like, oh, that must be personalized by like age, race, gender, ethnicity, based upon what's healthy for me. Nope, just one range for everyone. So a good example is A1C, tied to metabolic disease. Currently today, the largest labs and hospitals on earth tell you that an A1C of 5.7 or less is green or good. But I can tell you, if you take someone in their mid-30s that was a 5.0 last year, a 5.3 6 months ago, and a 5.7 right now, they're on a fast train to becoming a type 2 diabetic. Yet, if they look at their lab results, they'll see green. I'm healthy, right? So why we started this was a realization that the protocols and procedures that we use for screening, treatment of disease, lab reference ranges, all of this was antiquated, dated, stuck in the 1990s and driven by what insurance companies wanted to pay for, not driven by what was healthy for individuals. So the way that we think about it is the first thing that we needed to do was to build a nonprofit research organization where today we unite 112 academic fellows from across the globe that get together and say, what is an ideal healthy range or target ranges for people of this age, race, gender, ethnicity using population level data? How do we screen for these diseases using every tool and technology? How do we look at all of the new medical and scientific information and integrate it into our protocols? So the first thing that we did was actually come up with a new protocol for preventive medicine. The second thing that we did was we then said, oh my God, hospitals don't train doctors to practice preventive medicine. If you go to residency or you go to medical school at a top 10 academic medical school today, you will spend less than 60 minutes in those years learning about nutrition. You will spend no time learning about sleep. You will spend no time learning about functional medicine or integrative health. You will spend a lot of time learning how to do surgery, even if you want to become a primary care doctor, which I think is great, but we're not giving people the modern tools today to practice preventive medicine. So the next thing we did was we created 180 hours of educational content for our physicians, which we've now opened up totally for free on YouTube to any healthcare professionals that want to take advantage of them. And so I think the first part was figure out what are the new protocols or standard of care for preventive medicine, train and educate our team on how to practice that way, go and do it, create the data that proves that this is working, and then use that data over time to change policy at a global level. So that's why we have a nonprofit research organization, and what the mission is there is ultimately to prove that prevention works, to create free educational materials for patients and healthcare workers to practice this in an easy way, and to create the data that proves beyond a reasonable doubt that this will reduce cost to the system, prolong healthy life, and increase GDP productivity, which are all buzzwords for saying the government might actually decide that they want to fund preventive healthcare long-term and mandate it from employers.
I can very much hear and feel your mission that you're on, which is incredible. And as I said, it's a very ambitious mission that you are on to fundamentally rewire our healthcare system. I want to talk about the future. I think one of the things I'm most excited about as somebody who values health, it's the most important thing that we all have. This is probably one of the most exciting decades for health. I mean, there's just so many incredible things that are happening. I think you remember I sold my company to Northwestern Mutual, and when I was there, they extended the life expectancy tables to 120, which is just wild to think about. What do you talk a little fast forward 5 to 10 years? Like, walk us through what you think healthcare looks like in 5 to 10 years.
Yeah.
Talk about
I'll put a disclaimer on it. I'm an eternal optimist, so I should just start by saying that. I do agree.
Us both.
I do agree with you though, and we are entering right now, to me, what is probably the most exciting decade in the history of healthcare. For a couple of reasons. One, massive growing wave of consumer interest in preventive healthcare, wellness, and longevity, and we need patients that care. And the fact that patients care today more than ever before is good. Two, the pace of technological innovation, new tests, new diagnostics is more available than ever before and accelerating. The cost of these diagnostics is plummeting by the minute as well, and the availability of them is increasing. And lastly, then you have new technological breakthroughs in artificial intelligence that are capable of working 24 hours a day, scaling far beyond what humans can do in terms of their ability to interpret data, and likely develop new treatments, new drugs, new pathways, and biomarkers for us to target that we've never had before. So I think we're at the precipice of massive sea change in healthcare and in consumer primary care over the coming years. I think that there's no doubt in my mind we can eradicate cardiovascular disease. No doubt in my mind. Period. The costs are low, the technology exists, we just need to figure out how to scale it. I think that cancer screening is here, liquid biopsies are going to be more present, and there's going to be a lot more of them.
What's a liquid biopsy, really quick?
Sure, so the one that most consumers would know of is something called GRAIL, the GRAIL test. It's a multi-cancer blood test. Liquid biopsy is a fancy term for taking a vial of blood and testing to see if there's cancer in there.
Cool, great.
Is the easiest way of thinking about it. We are going to have more and more tests from the blood to be able to identify disease. That's cancer at early stages, that's neurodegeneration, Alzheimer's, Parkinson's, dementia. Those things already exist, and the costs are coming down as they come to market, which I think is really, really exciting. And I think the most exciting thing, though, is that, to me, AI is not here to replace doctors. AI is here to give physicians superpowers as well as patients what they've always wanted. So having the idea of an AI health coach that's on your shoulder 24 hours a day that can interpret your aura and sleep and CGM data and look at your labs and give you advice on what to eat, and you need 2,000 more steps a day for this reason, with objective feedback loops. So I think AI will enable all of us at a population level to have the same access to quality coaching, quality support, quality lifestyle management, and will enable physicians to do the work that only humans can do. So it's a long-winded way of saying, I think 10 years from now, it is very likely that we'll be talking about, on the preventive care side, the impacts of AI and the utilization of cheap diagnostics at a population level data point of view for that. And I think on the reactive sick care side, our ability with technology today to understand, sequence, and target specific cancers and create personalized N of 1 treatments, vaccines, etc. We're just in the earliest days where it still costs $1 million, but think about how much it used to cost to sequence a whole genome. Today, that cost is around $200. It started well over $1 billion for the first one. Today, we're able to create personalized cancer vaccines for about $1 million. Those costs are going to come down to a few $100s over the next decade as well. So I think because of the technological innovation, we're entering a time where you're going to have more equality in healthcare because technology can help us scale the things that we're doing for a very small audience today.
I'm going to ask a question I'm sure many people are thinking about, which is what you just said is incredible. Over the next, we'll even call it 15 years, significant costs will come down and we can play so much more offense. What does that mean for lifespan? Are we talking roughly, I think the average man lives till 85-ish. I think it's 77.
Yeah.
Women 83, something around there.
We're in the, dependent upon country, we're in the high 70s to low mid 80s. What's interesting is it's for some reason the term longevity has caught fire at a population level. It's everywhere you go, conferences, podcasts, ads, beauty companies are now selling creams as longevity creams. But what's interesting is there's two measurements. There's lifespan and there's health span.
Yep.
Lifespan is from the day you're born until the day you die. Health span is from the day you're born until the day that you don't really live a good life anymore. So let's just take an example. We both live till 90. You're super healthy, running around, playing tennis, doing all your things until you're 90 and you get hit by a bus. Your lifespan and your health span were both 90 years.
Yep.
I live till 90, but at the age of 60, I need a double hip replacement. I'm limping around. I'm in pain. I need a CPAP machine. I need dialysis, and I'm bedridden for the last 30 years of my life. My health span is only 60, even though my lifespan is 90.
Yep.
What's interesting is in today's world, we do not yet have any real things that extend lifespan. Almost nothing. But we have unlimited interventions that extend health span. So I think the goal for right now is how do we get people's health span to equal their lifespan? And that's what's most important. So from my point of view, well, average lifespan might be 79 or 80 years old. In America, I would argue that average health span is probably somebody's mid-60s. I think we're more focused at Atria. How do we get everybody to have 90 great years? Unassisted living, being able to wake up in the morning, pain-free, no pain, go live their lives. That is achievable with the technologies that we have today. I do believe there will be things in the future that come about that extend lifespan, but those don't exist today. So I think that right now what we as a healthcare system should be focused on is how do we get every single person on earth 90 good years.
I love that. I think how thrilled would we all be if we got 90 good years. I want that for everybody that I love.
Me too.
Alan.
By the way, if you talk to anybody that's in their 70s, 80s, 90s, they would tell you all that matters is being healthy, not how long you live.
That's right.
Feeling good.
Yeah, that's right. And that's what we want for.
And the unfortunate reality is that the decisions that we make and the actions that we take in our 30s, 40s, 50s, and 60s dictate the quality of life of our last trimester of life.
Which brings me exactly to my next question, which was going to be, for everybody listening, what's one thing that they should do tomorrow to improve their health? What's one thing that you would want everyone listening to walk away and do?
Yeah, this is going to be so simple, but it's give a shit. It's literally just care about your health. Everything else stems from that. If you wake up and you don't care what you put in your body and you don't care how you look and you don't care how you feel and you don't care how you sleep, nobody can force you to care. So the first step is caring. Decide and realize that the actions that you take dictate the quality of your outcomes. Once you realize that, the second thing I would say is know your numbers. There's 5 or 10 numbers, right? Your lipids, your blood pressure, your BMI, your insulin resistance. There's 5 or 6 numbers that really tell you the story of everything you need to know. Know your numbers and know what you need to do to impact those numbers. I think that's first. If you have the money and you're able to, I would definitely say it's worth the $150 to go get screened for cardiovascular health. It's only $150. Everything else, for the most part, is downstream from there, right? Like, know your numbers, care, don't be fat, sleep well, be happy, and spend $150 and get screened for cardiovascular disease.
Yeah, that for me is absolutely the biggest takeaway from this. I want to cover one more question on the future because I am dying to know how you think about it, which is obviously AI is incredibly powerful. I mean, I've literally dropped all my blood tests, everything into AI. It's incredible. It's like, I mean, the doctor still calls me and still take your doctor's phone calls because you want their actual opinion. But it really is incredible. From your vantage point, which is 100 times more informed than I am, how do you think about how is AI transforming preventative care in ways that you find fascinating?
Yeah. I think the first is being able to interpret large sets of data over a longitudinal period of time. The average patient, when you divide how many healthcare systems they go to, how many visits they went to, at Atria has about 700 pages of medical records. They're unorganized, they're unstructured. So I think the first is taking what used to be very human tasks for healthcare workers and automating them to allow physicians and clinicians to focus on what's impactful. I think the second is ultimately around identifying things through the analysis of that data that human beings simply would not be able to do. And I think the third is, as I said earlier, it's really around giving physicians superpowers. So when you go to the doctor, you're like, oh, I wish I could get a write-up of what we said and what to do, but you don't realize that your doctor might have 40 patients in a day in 12 minutes, and it would have taken them an hour to write that up. We now use something, a company here, where we do AI scribing. So as long as the patient wants, we have an ambient AI listener in the room. 5 minutes after that is over, we have a full summary of the conversation that was had, as well as the next steps and the follow-ups and the recommendations that can be sent to you in real time, right? So now you can have care plans in real time without it taking a physician 3 hours to do that they didn't have. So I think patient communication has been solved. I think documentation has been solved. I think medical records have been solved. And people don't realize, but being on the inside of the healthcare system, these are the things that drive costs. These are the things that drive the need for so many human beings to work there, an 8-to-1 ratio of administrators to physicians. So I think automating a lot of the human tasks in and of itself will be the biggest unlock over the near term, call it the next 3 to 5 years. I think that should increase accessibility and increase quality and lower cost. I think in the long term, AI is going to be able to identify questions for physicians that they might not think of themselves. So when we get a complex case here at Atria, we actually feed all of those patients' records and all of our questions into it. And we oftentimes will get back, okay, here's 5 questions to ask. 4 of them our team thought of, 1 of them didn't. And it's like, oh, we should do that test. We didn't think that it might be that. Because the way that most doctors work is what's called a differential diagnosis, right? They're like, nope, not that, not that, not that, not that, not that. And you just ask a bunch of questions. If you have somebody that has even more knowledge than you, able to throw more questions into the ring, it helps us get to answers quicker.
Well, Alan, I want to end on our quick fire round here.
Oh boy.
I'm going to ask you questions. First thing that comes to mind. First, is there a book that you read that's changed your life that you would want others to read?
I would say 2. I think Shoe Dog, Phil Knight's story was just an incredibly inspirational story, a fun read around just an incredibly driven entrepreneur that was never going to give up and was always going to be successful even while living out of the back of his car, selling shoes out of the back of his car. I think the second, I think in my industry, I would say, Peter Attia wrote a great book, Outlive, that I think it's a little bit dense, but if people make their way through it, they're going to wake up tomorrow and care about their healthcare. And I'd also, Eric Topol recently launched a new book focused on preventive healthcare as well, and I would recommend that as well.
And I want to end on one last question, which is, Alan, what is one health habit that you've adopted?
No screens in the bedroom has been the hardest one to adopt. But it's really changed a lot. And that's one that I'm focused on right now, but I haven't fully adopted it. I would say the biggest one that I saw just from like seeing my own health, how I felt and data, is don't eat late at night and don't eat and drink within 3 or 4 hours of sleep. Your body needs time to metabolize what you put in it. And if you can go for a 15-minute walk after you eat and try to eat earlier, but like late night snacking, drinking until the second you fall asleep, it really impacts your sleep. And sleep is the biggest gift, right? It's basically like you don't have to do anything. You just close your eyes and the body basically repairs itself while you are sleeping. So it's a pretty incredible thing that I think people, over time will understand the importance of.
I'll invite you to a 5:30 p.m. dinner reservation, which is my favorite dinner.
Well, it's funny, and I know we were running on time, but when I was running Spring, I used to like going out to dinner at 9:30 at night.
I mean, same. Like
here I am. The idea of eating after 6 p.m. I was like, no, I wouldn't do that.
No, not at all.
No.
Alan, first of all, thank you so much for everything that you're building. It really is incredible.
No, thank you for having me.
We're rooting for you, and I just deeply understand your ambition, and I'm really, really, really rooting for you. So thank you so much. And everybody out there, you can check out Atria.
Atria.org.
Atria.org. Alan, we're rooting for you. Thank you so much.
Thank you so much, Alexa and team.
Thank you so much for tuning in today. If you enjoyed the episode, be sure to like, subscribe, and share. We'll be back soon with another episode of Inspired with Alexa Von Tobel.